Hey there, it's Dr. Currie, and I just want to take a minute to review some really important instructions that you will be taking home with in written form after your procedure. And it's really, really important if you actually follow these guidelines, this will be an easier experience than you expect. Oral surgery can be no big deal, and it can also be a bummer. And it's usually a bummer because you're not following all of the instructions that we're sending you home with. And we've done this many, many, many times, and I know this may be new to you, but this is very common to us. And so we know the keys to success, so please just follow with me. And read this when you get home. Anybody that's going to be helping take care of you if you've been sedated, highly encourage them to read that as well. And there's keys to success right here. So number one, if you're having any kind of extractions done or any kind of implant placed, any kind of bone grafting, we're letting the blood clot heal or form or create strength. Meaning, if you skin your knee, it's going to form a scab, right? In the mouth, we call that a blood clot. So that's going to take place in the first few hours typically. The worst thing we can do is keep rinsing or swishing or wiping to make that blood keep having to start back over. So we're trying to protect that clot. The way that's going to happen is you'll go home biting on some moist gauze. You'll go home with a lot of extra gauze too. And gauze is just cotton. It's just sterile cotton that we're sending you home with. I mentioned to make it a little bit wet because dry cotton sticks to everything and feels terrible. Wet cotton doesn't feel bad at all. And it's just like putting pressure on a cut on your arm. If you stay biting and squeezing against wherever the tooth was extracted or the procedure was done, you won't have to do it for very long. Good pressure on a healthy person, we clot pretty quickly. But if you keep taking it out to check it, if you're talking a bunch, if you're moving around a whole bunch, that's just going to keep the bleeding starting. So try not to do that. Try in the first few hours to stay biting on that gauze, and you'll be done with that pretty quickly. If you want to have food, take it out, eat your food, and you can put it back in. If you want to take a nap, you're welcome to take it out. And once you get to the trickle phase, is what I call it, you don't really need the gauze anymore, meaning that active bleeding, consider that where if you bite on some gauze and you take that gauze out 10, 15 seconds later, if you can squeeze it and you can get a drop of blood to come out, that's bleeding. We want you to keep biting on gauze, apply good pressure. If you take the gauze out and it's got a little bit of moisture on it, maybe a little red, maybe a little pink, maybe a little clear, whatever, if you just have a little bit and you can't get any drips to come out, that's not actually bleeding like most of us think of it. It's just kind of weeping. Now your extraction site will weep or ooze for up to 24 hours no matter what you do. So once you get to that phase, you don't really need the gauze anymore. One thing we don't want you to do is rinse too prematurely. Saltwater rinses are absolutely critical, and in fact one of the best things that you can do to heal quickly and have this be a non-event, but I want you to wait a full 24 hours from the procedure before you start doing that. At that point, I want you to do very, very frequent but very, very gentle saltwater rinses. And when I say saltwater, it does not need to be super salty. If it's too salty, it will be gross. If it's mildly salty, that's all you need. What I mean by that is for every coffee mug of water, that's 4 to 6 ounces, just take a half teaspoon of sea salt. If you've got good cooking sea salt, that's the best. It's the closest minerality to our body. If you just got regular table salt, that's fine too. But a half teaspoon, just warm enough water to stir and dissolve it, let it cool down a little bit. And then when you get a mouthful, I don't want you to swish it around. That's a pressure change. I don't want you to forcefully spit it. That's a pressure change. We want you to just hold a mouthful. So if you got your wisdom teeth out, that's both sides, wherever you had it work, just tilt your head, wait 20 or 30 seconds, letting it just pool where it needs to be. Tilt your head, let it go to wherever else it needs to be. Lean over the sink or the trash can and let it just fall out. Let gravity do the work. Don't forcefully spit it, because pressure changes that I keep touching on, those are our enemies. Pressure causes swelling. Pressure changes cause discomfort and inflammation that you wouldn't have had otherwise. So pressure changes come in the form of swishing and spitting that we just mentioned. Sucking on a straw is a big one. A lot of people want to go home and they have a milkshake or a smoothie. That's great. That's fine. Just no straws, especially on a thicker liquid like that. When you're sucking, there's a heavy negative pressure that really pulls against that little blood clot that's trying to become strong, and you can dislodge it, which can cause dry socket, which is a very painful thing that's very avoidable, or you can just cause inflammation and discomfort like I mentioned. So watch out for heavy swishing and spitting. Let's give it a full 24 hours before you rinse it all, and then we're doing it very gently. No straws at all for at least the first week. If you have a milkshake or a smoothie, just eat it with a spoon, drink it out of the cup, and that's fine. Elevation of blood pressure is a way that we can create swelling that we wouldn't have otherwise, and that comes usually in the form of exercise or working out, heavy lifting, being too active or overexerting yourself in the first handful of days. Whenever you've got a recent wound, if you have an elevated blood pressure because you went for a jog or did some heavy lifting or exercise in some way, that's just going to pump pressure into that area. It's going to cause swelling and cause pain that you shouldn't have had otherwise. So be really mindful of that. People that are really into working out, all my gym rats out there, good on you. That's very, very healthy most times of the year, but give yourself at least 5 days out of the gym after any oral surgery procedure. Peak inflammation usually occurs at days 3 or 4 after your surgery, and then on day 5 kind of starts to come downhill. So picture a bell curve from day 0, right when you have the procedure, to the top of the peak is day 3 or 4. Anything that you do that increases pressure changes in those first 3 or 4 days, that's going to increase how uncomfortable that bell curve goes, how high that bell curve goes. So you can make it into a mountain, or you can reduce it down to a molehill if you follow the instructions and minimize all the pressure changes that we can. Once you get to day 5, you're typically out of the woods and you're on the downhill, and at that point it should just be getting better and better and easier each day. So if you can wait till at minimum day 5, ideally day 7 before you hit the gym, you'll be happy you did so. Otherwise you'll just cause a bunch of pain and you won't want to go back to the gym for 2 more weeks, and it'll actually set you back worse than if you just taken 5 days off. Similar goes for high altitude flights. If you're trying to fly to Europe or somewhere that's going to be a prolonged high altitude flight, we really want you to do that 7 days or longer after your procedure. Maintained altitude pressure is just like kind of sucking on a straw. It changes the pressure for a long enough time that you can cause discomfort and swelling. Staying ahead of the discomfort and minimizing the swelling can also come in the form of medications. So we typically are going to be prescribing ibuprofen. That's like Advil. Ibuprofen is the generic name for Advil or Motrin. It comes in 200 milligram pills over the counter. So the 600 milligram dose is typically what we prescribe. That's once every 6 hours. That's wonderful at preventing inflammation. So even if you're not hurting at all, taking your ibuprofen on a strict schedule can really help minimize how big that bell curve is. Keep it down. So that's another way to stay ahead of it. Tylenol, if you're able to take Tylenol, you can also add that in with the ibuprofen and alternate back and forth. On the back of this page, there's 2 sides. One of them is a medication cheat sheet. Please read through this carefully. It's kind of pharmacology for dummies here. You can have no idea about anything I'm talking about, and if you read through this, you'll do fine. But ibuprofen comes over the counter. It also comes in prescription form, so make sure that you know which one you're taking. Tylenol comes in multiple forms, so again, read through this and figure out what you're taking. Usually it's take 2 of the regular Tylenol or 1 of the extra strength. Again, those are 6-hour doses just like the ibuprofen, and the key there is an alternating schedule, which you'll see an example schedule right here. Take your ibuprofen, wait 3 hours, take your Tylenol, wait 3 hours, you're back to the ibuprofen, wait 3 hours, you're back to the Tylenol. So it's just a 3-hour rotation back and forth. Set a timer, write down a schedule. When you go home, you're going to be a little groggy. Somebody else may be taking care of you. So it's really great if you guys keep a good notation on a piece of paper in your kitchen or bathroom, wherever you've got your medication, so that you know exactly what you took and when. If you do this and you stay ahead of discomfort, it'll probably not be a big deal ever. If you wait until it hurts, you end up taking far more medication than if you had just stayed ahead of it. If you are taking narcotics such as hydrocodone, that's for some of our bigger surgeries or more uncomfortable ones. You do the exact same rotation, ibuprofen, hydrocodone, every 3 hours, alternating back and forth. And that works beautifully as well. But the Tylenol ibuprofen combo, it's far more effective than people realize, because you don't feel like you're on a painkiller, in the sense of it doesn't make you groggy or sleepy or nauseous, or there's no fear of addiction or constipation or just any of the negatives of a painkiller. Now that being said, not everybody can take ibuprofen, so please make sure that you're allowed to take Advil, whether you have kidney disease or something of that nature. Please make sure that you do what's correct for you, and talk to me or talk to your physician. I'm happy to talk you through it. Tylenol, that's a liver metabolized drug, so what's important to know about that is you should not be drinking alcohol if you're taking any kind of Tylenol or any of the painkillers, the hydrocodone. You definitely should not take any or drink any alcohol if you're on the day of sedation as well, because we've got sedation medications that are floating around in you for about that first day. Ibuprofen does not interact with alcohol. That's safe. I'm not going to tell you to use alcohol instead of Tylenol or hydrocodone, but just for your own safety, just know that ibuprofen should be our safest constant, and you alternate with either Tylenol or hydrocodone. Works beautifully, and again, stay ahead of it. It's all about staying ahead of it. Eating, when you leave here, you're welcome to eat right away. It's just all about your safety, meaning you're going to be numb somewhere, and so we really don't want you to bite your tongue or burn your cheek or bite your lip, one of those things. So anything that's hot, like soup or coffee, let it just cool down to be more of like a mild, warm temperature, so you're not burning yourself. If you're having to chew food, we really don't want you to have to chew anything for the first meal or two, so that we can get past the numbness. Once the numbness is gone, it's typically whatever's comfortable to you. Spicy things, very acidic things like orange juice or tomato soup can be uncomfortable. Very hot temperatures and very crunchy things can all be tender to recent oral surgery sites. We typically want to stay away from crunchy for sure, just in case you've had an extraction. You don't want something crunchy like granola or something hard to get down into an extraction site. It's very uncomfortable, it's hard to get out, and it doesn't dissolve very easily. If you're wondering, can I eat this, should I eat this, the fork test is a good one, meaning if you can take a fork and cut your food with the side of the fork or smush it with your fork, you're quite safe there. One thing that people don't see coming is leafy greens. Watch out for leafy greens sometimes if you had some extraction sites, because if a piece of lettuce or something gets down into the hole, it doesn't break down very quickly, and it can be uncomfortable and hard to get out. So put it in your smoothie, blend it up, just don't use a straw and drink it, and get all those good nutrients that way. Toothbrush. You're welcome to brush your teeth when you leave here. We'll just want you to be gentle and maybe avoid the one, like say we had one extraction here, avoid the tooth or so on either side for the first night or so. And then after that, I want you to brush pretty normally, but normal should be gentle. We don't need to scrub really hard to be very, very effective. So gentle, soft, but thorough brushing of the neighboring teeth is important. I do not want you to brush your area where you had a bone graft. Like if you have extractions or missing teeth, basically, if there's a hole there, you don't need to water pick it. Don't do that. That's like a pressure washer going into a recent healing site. You don't need to scrub on the sutures or anything with your toothbrush bristles. That's uncomfortable, and that can cause them to loosen or stretch or something. That's what saltwater rinses are for. But I do need you to brush your existing natural teeth, and that way we can keep that area clean, because obviously a clean mouth is going to heal better than a dirty mouth. If you use an electric toothbrush, please turn it off so that the vibrations don't bother you, or we typically send you home with a soft bristle mechanical toothbrush that you can use for the first week or so until that's no longer uncomfortable. Whenever you've had oral surgery done, you may also have some sutures in place. We use a wide variety of different sutures for different reasons, so make sure that if you're curious, you ask us specifically, but we'll typically give you a heads up, and that usually they will dissolve on their own, and depending on what we had done, sometimes they dissolve in 3 to 5 days, sometimes 7 to 10, sometimes around 14. If it's going to be longer than 2 to 3 weeks, we'll typically already schedule you to come back in to have a suture removal appointment, which is also a very quick, low-key, easy appointment, so don't stress on that. There's usually very little to no discomfort. We don't typically have to numb at all. It takes 5 minutes. It's usually very, very quick and easy, so don't stress on that. But whenever there are sutures, just remember that the salt water rinses that I was talking about earlier, that's going to be really helpful to keep them comfortable, to make them dissolve on the earlier side, which patients typically prefer. And the main rule is just try not to mess with them. We did a very careful, delicate job of putting them exactly where they should be, and we just try to not fiddle with them with your tongue or brush on them with your toothbrush. So just remember that salt water keeps them clean. They will typically take care of themselves, and if not, we'll give you a heads up and we'll plan on taking them out at a later date. Medications, please always be very vocal about any kind of medication allergies. We'll usually ask you multiple times before a procedure to verify that you don't have any medication allergies, but please let us know. Also, let us know if you have any issues along the way with the medications that you're taking after your procedure. Typically, people do great. We use only a handful of medications that are usually well received, but everybody's different. And so if you're on antibiotics, I really recommend taking some probiotics. Probiotics are usually found just on the vitamin aisle or somewhere near the pharmacy. You can ask the pharmacist if you'd like. If you see any of the ones that say something like delayed release or extended release, you'll usually get a little better effect for those. But antibiotics, they're great to protect against bad bacteria or to kill bad bacteria, but we also have good bacteria in our GI, in our stomach, and our intestines, and it's very important that we keep the healthy bacteria there, and that's what the probiotics are for. So anti kills bacteria, pro puts it back, but we kill the bad stuff, we put back the good stuff. So if you're taking the probiotics, try to space them out from when you take your antibiotics. The antibiotics are typically 3 to 4 times a day. So I know it's a lot to have a schedule, but it's all about a schedule on all of this stuff. So when you're writing out when you take your ibuprofen or your Tylenol or your amoxicillin or whatever it may be, just also factor in taking a probiotic once or twice during the day, ideally spaced out 2 or 3 hours after or before your next dose of antibiotics. Other than that, typically we will have talked to you about anything that's personalized for your experience, but on the bottom of the sheet you'll see a cell phone number typically for your treating doctor. Make sure that you use that if you need it. We're here to be at your service, that you can text us or call us if you have any questions or concerns. We typically want to hear from you directly as opposed to going through the on-call service if you've just had a procedure done, meaning the first 2-3 weeks or so, if you've had some new occurrence or you're worried or concerned, it's best to reach out directly out to the doctor if it's after work hours. If it's during work hours, you're welcome to call the office, and typically we can respond to you right away too. If it's months and months later, please just call the office and everything, because it's already, the procedure's long since been done and it's a little bit different scenario, but we're at your service, we're here to help, and we want you to be able to get a hold of us if you need us.